Hello and welcome to Siteman Cancer Center, based at Barnes Jewish Hospital and WashU Medicine. Our dedicated team of physicians, nurses, and other care experts is here to help you begin your chemotherapy treatment and navigate your care journey with peace of mind. This is likely an emotional time for you and your family, one filled with questions and concern, but nobody faces cancer alone, and our community of caregivers is here to support you through every step of your treatment. Siteman Cancer Center has 7 convenient locations in the St. Louis area. We appreciate your trust in us and are dedicated to supporting you through your treatment. The goal of this video is to talk through what you can expect during your first chemotherapy session. When you arrive, please check in for a blood draw, also known as getting your labs drawn. Your lab results will help your doctor and pharmacist determine the dosage of your chemotherapy medication, as well as any other medicine you might receive. This appointment is scheduled far enough in advance of your doctor appointment to allow enough time for the doctor to review the results. If you receive a port, it will be placed underneath your skin on one side of your chest. A nurse can use a special needle to draw a blood sample from the port. We will use your port later to administer your treatment. If you're not receiving a port, you will have a blood sample drawn from your arm in our lab by a phlebotomist. If you don't need to meet with your physician, you'll be asked to stay in the waiting room for about an hour while your care team reviews your lab results. Every care team member you meet on your first day works in coordination or partnership to deliver your care and treatment. Each physician has a nurse coordinating your care. Some physicians also have an advanced practice provider, or APP, which is either a nurse practitioner or a physician's assistant. There are times when an APP will treat you during your doctor visit. After you meet with your physician or advanced practice provider, your lab results will be reviewed. This is when any necessary changes are made to your chemotherapy medication order. All medications are customized for each patient, and safely administering them is the care team's highest priority. This can result in occasional treatment delays as we work to ensure that all safety measures are met. When your lab results are back, you will be taken to the infusion room. On the way, we will record your vitals, height, and weight. Patients are allowed only one visitor in the treatment room. Children are not allowed in the treatment room. If your chemo will be administered through an IV, your nurse will place it where appropriate. Your nurse will also discuss your lab results, noting which specific treatment regimen you'll receive for the day, and answer any questions or concerns you may have. Chemotherapy is tailored for you on each visit based on your diagnosis and what your doctor has ordered. In some cases, you may be given medications about 30 minutes before treatment to help with any anticipated side effects, such as nausea. Your medications will only be prepared once you're in the treatment area and all safety checks have been completed. While the infusion team prepares you for treatment, your pharmacist will prepare your chemotherapy medication. Treatment times also vary according to each patient's unique diagnosis and treatment plan. Your nurse can estimate how long your first chemotherapy treatment will take. You may bring food and drink into the treatment area, as well as items you enjoy, such as books or tablets. Be sure to make plans for someone to drive you home after your treatment. You may wonder how you'll feel when your infusion starts and after your treatment. Most patients don't feel sick during infusion, but let your nurse know if you start feeling unwell. Your nurse will also review common treatment-related side effects and how to handle them if you experience any after you leave. Depending on your treatment, potential side effects can include fatigue, nausea, diarrhea, mouth sores, or hair loss. Due to advances in medication, some patients may not experience many side effects, but everyone responds to their treatment differently. If you're not feeling well or have questions about how you're feeling, speak with your nurse or physician, who can recommend ways to manage these side effects. As you begin treatment, know that a wide support network, including dietitians, social workers, and psychologists, is here for you every step of the way at no additional cost. Your specially trained care team will work with you and your family to answer any questions or concerns you might have, and to make sure all of your needs are addressed. Our dietitians provide nutritional counseling during your treatment and recovery, and explain dietary techniques for dealing with side effects. Licensed clinical psychologists can help with problem solving and provide psychotherapy for patients and their families to talk through physical and emotional aspects of cancer. A social worker can address concerns about insurance and other financial needs and can connect you with resources to help with lodging, transportation, support groups, and more. We understand that this can be a difficult time for you and your loved ones. At Siteman Cancer Center, we are with you every step of the way,